I'm Xiao Huang from Institute of Hematology, Peking University.
Dr. Xiao Huang's research group has published several articles on transplantation in blood.
I and my team work very hard to try to publish our work in Blood Journal. My work focuses on the transplantation, especially hyperidentical transplantation. Last year, we published a paper in Blood. We established a novel approach for hyperidentical transplantation for treatment with acute myeloid leukemia. Before our publication, usually it is thought that hyperidentical transplantation will associate with high incidence of rejection and high incidence of severe GVHD. In 2000, I tried the first cases of hyperidentical transplantation, used GCSF, mobilized bone marrow, and peripheral blood harvest. With this cell source, we have decreased the incidence of GVHD and make the hyperidentical transplantation safer and reliable. This approach has been applied routinely for the clinical treatment. In 7 years, the percentage of hyperidentical transplantation increased from 20 to 40%. Recently, we published another paper, Who is the Best Donor? As we all know, we have long been short of donor. Because of development of hyperidentical transplantation, now everyone have at least one donor. Not only everyone have one donor, based on our publication, we show search for best donor. So we need to know who is the best donor. We can improve the clinical result by selecting the best donor. And also we published another paper in Blood Journal. The story is that we use MRD to identify patients with high risk of relapse, then preemptively with this modified donor lymphocyte infusion, we found we can decrease the relapse rate. Transplantation remains one of the most effective therapy, and all my team will still focus on the transplantation improvement. And with the improvement of this system, I'm quite sure the number of patients receiving hyperidentical transplantation will increase continuously.